Hi, I'm Dr. Uday Nagesh Shivaji. I'm a consultant gastroenterologist and head of gastroenterology and hepatology at Narayana Health, Bangalore. I have a special interest in inflammatory bowel disease. The answer is it can affect other parts of the body. Primarily, the gut is inflamed, but about 30% of patients with inflammatory bowel disease have involvement of other organ systems, most common being the eyes, the skin, and the joints. There are other organ systems involved as well, but majority of our patients have these organs affected. The simple answer is yes. Fiber is quite an important part of a diet for any person, and so it is for patients with IBD. The amount of fiber may need to be regulated based on how the patient's symptoms are. If they are in remission, they should be taking normal amounts, but you may find the gastroenterologist trying to reduce the amount of fiber during flare-ups. Yes, there are many tests called where we study biomarkers, and these could be based on blood tests. But the most sensitive test we have so far is called the fecal calprotectin, which is called a non-invasive biomarker, which is very useful for monitoring purposes. The gold standard of assessment still remains a colonoscopy, but this is quite an accurate measure of inflammation or remission. The most important, I would say, is adherence to medication and monitoring. So I would highly recommend that patients continue to take medications as advised by their gastroenterologist or IBD specialist. If there are side effects, I advise that you consult again, because there can always be alternatives that can be proposed. The risk of relapse is much higher, according to research, if you stop the medications without consultation or prematurely. And the secret to keeping in remission really is just continuous monitoring, roughly in the range of every 3 months or so. Yes, there has been a lot of research into it. Unfortunately, there is a slightly higher risk, but it is not as significant as it used to be about 15 or 20 years ago. The risk is slightly different for patients with ulcerative colitis, and if the entire colon is involved, the risk is a little bit higher. For Crohn's disease, it appears to be much lower, but when comparing to a normal individual who does not have IBD, this risk remains higher. Now, the good news is the risk can be brought down significantly if the patient is in remission for a longer duration.